Connecticut. But with summer activities, can we keep our curve flat? Joining us to talk about that and other topics is Dr. Virginia Bieluch, Chief of Infectious Diseases at the Hospital of Central Connecticut. Doctor, welcome back.
Good to be here, and good afternoon.
So, lots of recent reports about a possible vaccine close to market. What are your thoughts on a vaccine? Are we likely to see one soon?
Well, vaccine development is working at an unprecedented rate currently. As many of your listeners probably know, earlier this week, the initial phase 3 trial was launched looking at the Moderna vaccine. They are anticipating enrolling 30,000 people, and that's going to take some time. And then they will be monitoring those patients for safety, antibody production, and most importantly, whether or not the vaccine is protective. And it's my understanding that over the next few months, we'll see more phase 3 trials of other vaccines launched. So I'm hopeful, but it is going to take a few months. We're giving a vaccine to an otherwise healthy person. We want to know that it's safe, and we want to know that it is efficacious. So it's going to take a few months, but I've never seen anything work at such warp speed, as they say.
It's been amazing. So once we have a vaccine, how will things change?
Well, the other point I forgot to mention is that the government and the pharmaceutical companies are actually manufacturing these vaccines. That way, if the studies show that the vaccines work, they will be ready to start vaccinating individuals that are accepting of the vaccine. Exactly what's going to happen is really going to depend on the efficacy of the vaccine and how many people choose to get the vaccine. Is the vaccine going to be 60% protective? Is it going to not necessarily protect us against getting sick with the virus, but ameliorating or lessening the symptoms of the virus, improving the death rate, etc.? All that remains to be seen. The more efficacious the vaccine, the more life will go back towards what we knew as normal pre-COVID.
Can you just explain what efficacious means to everybody?
Efficacious means how well the vaccine works.
Excellent.
And some vaccines are really protective against getting disease, such as measles vaccine, which protects well over 90% of people from ever getting measles. Other vaccines, such as the flu vaccine, are more protective against getting serious illness. They may not necessarily protect you from getting the illness, although they do in many cases, but the disease you get with influenza vaccine can be milder. So the data are still forthcoming on how efficacious all of these vaccines that are in the pipeline will be.
All right, excellent. Dr. Virginia Bieluch, thanks again for being with us once again. We appreciate your time.
You're welcome.
Thank you.
Thanks.
Well, an 81-year-old man, famous for his singing voice, serenaded the staff at Gaylord Specialty Healthcare in Wallingford this morning.